Duchenne muscular dystrophy is a genetic disease which is X-linked and leads to progressive muscle degeneration, muscle weakness, loss of muscle function, loss of ambulation, respiratory and cardiac problems, and premature death. It initially appears in the early ambulatory stage, so you'll see subtle signs of Duchenne, such as difficulty walking, running, and jumping, and you'll also see Gower's maneuver, which is a classic movement characterized by the child trying to stand themselves up using their hands. DMD patients go for treatment in specialized therapeutic treatment centers that specialize in multidisciplinary treatment. And the clinical team is made up of a lead specialist in neuromuscular management, a pediatric or an adult neuromuscular specialist, and a care coordinator who helps communication between the patient and the neuromuscular team, as well as communication between the patient and the patient's primary care provider. So the first aspect of treatment for patients with Duchenne muscular dystrophy undergoing a treatment plan would be neuromuscular management. So the patient would have neuromuscular special appointments every 6 months, and they would have a physical or occupational therapist that they would be able to see every 4 months. And they would likely also undergo strength evaluations such as range of joint motion tests, which will monitor for contractures to determine which stretches are best for that patient. As well as timed tests, which could include distance, walking up and down the stairs, or getting off of the floor, and finally also motor function scales. So next we have steroid management. So patients can undergo steroid therapy, which research has shown will slow the loss of muscle definition or slow muscle degeneration. So they'll undergo dosing regimens, and the most common steroids used for DMD patients are prednisone and deflazacort as of now. The benefit to prednisone is that it's cheaper, but the benefit to deflazacort is that it lowers the risk of any weight gain or behavioral problems. And of course the physicians can monitor the side effects and dosage, and the patient can discuss that with their neuromuscular team. Next, we have endocrine management. So it's recommended that DMD patients have a specific pediatric endocrinologist because in young boys, the growth hormone and testosterone may be affected. And they can undergo growth hormone therapy if they'd like, or they can get intramuscular injections for testosterone, which will mimic puberty, and it's very important for bone health. So next we have rehabilitation management. This includes physical, occupational, and speech therapy. The doctors in rehabilitation management could include physicians, physical therapists, occupational therapists, speech-language pathologists, orthopedists, or any other providers. Rehabilitation is typically assessed every 4 to 6 months. And patients can be prescribed a certain amount of aerobic exercise, and their stretching and bracing can be monitored. This treatment section also determines whether you should be walking, having a scooter, a wheelchair, or whether you need any other assisted devices or additional adaptation devices that can help patients get up and down the stairs or bathe. So next we have cardiac management. In cardiac management, the patient will have a cardiologist that they will see at least once a year. And typically they get tests such as an ECG or EKG, electrocardiogram, which will be done, and a cardiac MRI as well, which will give a better picture of the heart. And physicians might also have a Holter monitor put on the patient to monitor how the heart behaves throughout a period of 24 hours or more. And female Duchenne carriers will see their cardiologist at least every 3 to 5 years. Cardiac management therapy includes the use of angiotensin-converting enzymes, ACE inhibitors, beta blockers, and diuretics. And your cardiologist can look for other palpitations or heart defects. So next we have GI management, which mainly focuses in maintaining good nutrition for the patients. Your physicians in this section will monitor BMI and establish a well-balanced diet for the patient. They'll take care of serious GI issues such as abdominal pain, nausea, vomiting, and difficulty swallowing. And the primary role of this treatment is to prevent and deal with dysphagia or constipation or gastroesophageal reflux disease. And some tests that may be done include x-rays or clinical exams, and treatments can include medications or potential surgical interventions as well. So next we have bone health management. So bone health management basically prevents the muscle from weakening and prevents decreased mobility. So one exam that's done in this area is DEXA, which is dual energy X-ray absorption. It's a non-invasive test that measures the bone density in your limbs. And usually people have those done every 2 to 3 years. And then also, bone health management includes checking for vertebral compression factors, because people with DMD are susceptible to these, and they can take bisphosphonates to treat that, as well as getting lateral C-spine x-rays every 1 to 2 years. Next we have pulmonary management. So a big thing in pulmonary management is sleep studies to check for things like sleep apnea. So if it basically evaluates how well a patient is breathing while they're asleep. So if their breathing levels are too low, they may undergo a test called bilateral positive airway pressure, or BiPAP, which will help improve their breathing while sleeping. They can also have a specific pulmonary team with a pulmonologist and a respiratory therapist that they can see yearly, and they may be provided with non-invasive and invasive ventilatory support. They may also undergo tests such as forced vital capacity, maximum inspiratory, and maximum expiratory pressure. So next we have orthopedic management. So this checks for symmetry as well as spinal extension. And people, DMD patients who are not on corticosteroids, 90% of these people actually have a chance of developing scoliosis, a progressive scoliosis. And another issue that's dealt with in orthopedic management is the possibility for fat embolism syndrome, which is when fat embolisms, where a chunk of fat breaks off and it travels through the bloodstream. So finally, we have psychosocial management, which is a very, very important aspect of treatment, and it cannot be understated. There are a lot of different issues that can arise psychosocially in DMD patients and contribute to difficulty socializing, issues learning. They can provide anxiety, behavioral issues, and even depression. So psychosocial management obviously manages the psychosocial well-being of the patients and their families as well. Psychotherapy and coping methods and coping mechanisms are often utilized, and psychosocial assessment, cognitive and language assessments are all monitored. And a neuromuscular care coordinator works a lot in psychosocial management and can help with future education and employment opportunities, specialized individual education plans, learning skills, and palliative care treatments for emotional and spiritual support. So all of this information was taken from the Parent Project Muscular Dystrophy Parent Guide. We essentially chose to focus on the clinical care model that alleviates symptoms for patients suffering from DMD. Our narrative focuses on an overlooked principle: young boys suffering from Duchenne are kids first and then patients. We were interested in learning about and consequently elucidating to our community the details of the multidisciplinary clinical care model. And we think it's important to realize that although DMD is a disease that causes skeletal muscle degeneration, the detriments experienced by the body span across each organ system. And considering that most patients are very young, extra care needs to be taken while choosing treatment options, because these patients are still growing and each therapeutic agent comes with its own side effects. Apart from medication, clinical care comprises of physical and occupational therapy, diet monitoring, and filling a ton of paperwork for insurance. So we thought it would be good to hear an insider's perspective on the coordination behind this clinical care, and we contacted the Muscular Dystrophy Association of LA, a nonprofit organization based in the greater LA area, and we interviewed Rachel Burris to explore how she and the organization she works for makes life easier for patients suffering from DMD, as well as their families. I've inserted this citation below. Thank you.
Hi, Rachel. This is Anahita from UCLA. My friend Swati and I are doing a community project assignment for our class PS121, which is based off of Duchenne muscular dystrophy. The theme we're studying this quarter is storytelling, and we really appreciate the opportunity of talking to you and hearing a little bit of the compelling narratives you have as a result of so much patient contact and contact with their families. And again, thank you so much for letting us do this.
Yeah, happy to do it.
Okay, so just for a little bit of an introduction, Rachel, what is it that you do?
I am the Associate Director of Care and Clinical Services, so I interact with the patients and families, as well as the physicians and clinics anywhere south of Utah and west of New Mexico.
That's great. Thank you. So to get a little bit more background on the Muscular Dystrophy Association, would you mind telling me how exactly does MDA help patients with DMD? Do they fund DMD projects or provide patients with resources? What is it that they do?
Sure. So we're involved with patients from beginning to end. So whether they are still on the path to finding a diagnosis or just doing symptom management, we have services for them. So what that looks like is having clinical centers all over the nation, all of which go through heavy vetting processes to ensure that they're offering best-in-class services. That means they also would be receiving funding from us to ensure that they're able to offer a variety of multidisciplinary therapists that would all be available to see patients in a given day as opposed to making separate appointments. We would also be the top funder of most of the diagnoses we cover outside of the federal government. So that would include Duchenne as well. And then we do a lot of local activities and involvement, anything from educational seminars, support groups, loan closets for durable medical equipment, and any other kind of social event.
Wow, that sounds phenomenal. Thank you so much for doing such incredible work.
Sure.
So, since the work you in the MDA do is so diverse, can you explain to us a little bit about the interactions you have with patients specifically?
Definitely. So with my position now, a lot of my focus is more on the programmatical functions of our company and a little bit more internal than, say, the care specialist. So I work with a handful of care specialists all over the Southwest that are in the clinics every day, and they're meeting face-to-face with the families and ensuring that they understand what services are available to them. And not only those services that we offer, but also making sure that they know how to navigate and access other services that would be available in their community. So a lot of that knowledge is gained locally and, really built upon from one individual to the next within the office to make sure that families have access to whatever it is that they might be looking for on those clinical appointment days. And then we're also there to engage with our physicians and make sure that what MDA is offering from their standpoint is useful and helping them do their jobs better and ensuring that they can keep their focus on the patients and really do what they're there to do. So that means bringing in social work when families have social work issues, or knowing that a family needs PT and OT support, which would be physical and occupational therapies, and just kind of making sure that MDA is supporting those needs on a larger scale.
Understand. So in terms of your interactions with the care specialists, then is there like a common theme from those interactions, or is there any major concerns or specific goals you are working with the care specialists to achieve currently, or something that's been on the trend recently?
Yeah, I would say there is, and I'm not sure if it's quite what you had in mind, but I know one of the things that I've been focusing on a lot with them is our level of engagement at care centers and getting some continuity from all of our specialists across the nation to ensure that we're consistent between locations. So that would be, for example, to make sure that a family in Ohio is hearing similar information and understands our services just as well as somebody in LA might, and being able to talk to those services. I know another big push, which is always the care specialist favorite subject, is our summer camp for a lot of the younger kids. And a lot of our campers tend to be boys with Duchenne, because that's just a very large population of, I would say more so a large proportion of our muscle weakness kiddos between 8 and 17 would have that Duchenne diagnosis. So whenever camp season is coming around, it's always a focus of ours on ensuring that those kids are having the best time possible, and how we can make the camp more adaptive and more accessible for them.
That's so incredible. No, exactly. It's not that we had something specific in mind. This is actually exactly what I was looking for. Thank you for being so helpful. So,
sure.
Okay, let's focus a little bit on the summer camps, if you don't mind. How is it that you plan for maximum accessibility and maximum comfort for these boys who have been diagnosed with muscular dystrophies? What are, say, 3 special features about your summer camp?
I would say one of our biggest pushes in the last couple of years has been to really evaluate the camp facilities that our camps are held at, and ensuring that they're the best facilities possible. Not just going with a facility because we've always had it or because it's the only option in the area. We won't sacrifice, quality of camp and accessibility in order to make something happen. And, if it's not there, we'll find something else to make it work. So I would say their safety is huge. It always comes first. It always will. And then community would be another one. We have an intense vetting process for all of our volunteers, and it entails a long application, several reference checks, a background check, a physical, and interviewing processes. So it really is making sure that the attendees who come to spend time with these kids and take care of them during that week are coming for the right reasons, and that they're qualified to do so.
Gotcha. Okay. Wow. Thank you. You guys do sound very thorough. That's great. So what would you say is the most rewarding part of your job?
I would say the biggest reward I've gotten out of it, and the one that actually ended up surprising me the most, was how connected and close we're able to get to these kids through our camp program. I didn't come to MDA with a camp interest. I was more of a clinical background and more interested in that clinical side. And people tend to come to MDA for one of 3 reasons: either event planning and camp, or fundraising, or healthcare. And so I came from that healthcare side, but exposure to camp and seeing those kids get to be themselves outside of a clinical setting was huge for me, and impacted me in ways that I never expected, and I thought it was just an incredible place to spend a week with a lot of amazing people.
That's so beautiful. So just building up on that a little bit more, how do you think working with these children affects your outlook on medicine and treatment in general? Considering this is a disease that predominantly affects younger boys, do you think there is enough awareness in our community today?
I think we could definitely have more awareness, but I think what I've gained more out of interacting with that population is that it is, a pretty progressive and intense condition. It very much so impacts their daily life, but they're also just kids and they enjoy things that every other kid does. And just because medicine and doctors have one opinion, the family's thoughts and feelings still are a huge part of deciding what's best for any given individual, and that is important to kind of keep in mind. And what I love about all of the care centers we have is that the physicians are so accommodating to understanding where a family is coming from and what makes the most sense for them. So that's kind of what I get out of it. For the awareness piece, I think we could, definitely be doing, there's always more to be done in that field, because it is such a small population of individuals being affected. Word of mouth only goes so far before you need larger events and pulling things together, and that's one of MDA's focuses, is building a bigger community out of these small communities. So connecting our families with Duchenne, with families with ALS, and families with SMA, and all these other acronyms that are endless. We cover about 43 different muscle diseases, and when those are only, a handful of individuals in a population, you multiply it by 43, and you've got a lot more people to start talking about muscle weakness and the advances that we need to see in the field.
Mhm. Yeah, I totally agree. So, wow, that is seriously wonderful information. But what, in your opinion, do you think is a good sort of means or medium to spread awareness about not only Duchenne, but other sort of muscular dystrophies too? Like, what, in your experience, has been a very powerful source of communication with, say, the extended members of the community, or with people who, or with families who are just receiving a diagnosis of Duchenne and the path that lays for them in the future?
So as far as sharing information among the community, there's no bad medium, but I think one of the most underutilized mediums with the most capacity to be taken advantage of is social media. I'm a millennial, so I'm on there all the time, and I can see how things go viral and people are suddenly made aware of things. One example of that is just the Ice Bucket Challenge. Like, it came out of nowhere overnight, and we received donations out of that, which was great. But even more so, it was word of mouth, people talking about it, getting online and seeing those videos. People wanted to know why, and I think even just in clinic, families, before they ever got their diagnosis, they said that that's their understanding of the muscle condition, ALS. Like, it was the Ice Bucket Challenge that kind of like opened their eyes to that. So social media, I think, is huge. For families getting the diagnosis, I think what's most important for them to focus on is their understandings with their clinical team, and really getting comfortable asking questions, and getting comfortable with us as an organization to support them, and becoming comfortable with, depending on people you don't know to give you advice is huge, especially when you'll be interacting with these individuals a whole lot more than most healthy individuals would.
I understand. Absolutely. Well, no, I completely agree. And so if it were up to you, what is some advice you'd have to give to students like me or my fellow classmates who would potentially be interested in getting involved in muscular dystrophy outreach or research, or potentially volunteering with your organization?
Yeah, I would say the biggest volunteer opportunity that almost anyone can do when they're in college is coming to one of our camps. We have them nationwide, so whether you go home for the summer or you stay in LA, there's a camp close to you, so you can get on the website and type in your zip code and see what your options are. And that it really is one of the most impactful ways that you can get involved, and you will be at the bedside with these kids, seeing how not only just giving support to them changes their outlook on life, but also what their medical care looks like. You're going to see what kind of stretches they need. If you have any kind of medical interest, you're going to have your eyes opened by your time at this camp. It's going to be meaningful. I see so many of our counselors coming back from their first year of medical school and talking about how important that their weeks at camp had been to the process and how valuable it was to them. So definitely get involved with camp if you have even the slightest inkling that it might fit your schedule. Outside of that, I think for anyone, I mean, no one experience is going to make or break your application. So definitely getting involved with the research, get on clinicaltrials.gov and see what kind of studies are going on, see what schools are hiring for interns. That was really important to me in deciding and how I got to MDA, and that's what led me to the company. So those opportunities are equally as important.
Wow. Thank you so much. I'm sure listening to this spiel, a lot of my fellow classmates and members who will eventually see this video would be interested in applying to be camp counselors. I think it'd be a great experience, especially since a lot of us want to be involved in the field of medicine as doctors and other healthcare professionals. So I think that's been really, really informative. Thank you. And just as some concluding remarks, is there anything in specific, a special story, or again, just a message from within your work experiences that you'd like to share with students like me who are taking a class as focused on a specific kind of muscular dystrophy, which is Duchenne, and how something you learned from your patients or the kids you interacted with in camp or their families, just as some concluding remarks.
Yeah, I mean, I think the biggest takeaway is the same one I tell people at camp. These kids with Duchenne are first and foremost just kids. So keep that in mind in all of your interactions with them, and you'll have a good time. They will light up your day. So that's, I think, all I've got.
That's beautiful. Thank you. Thank you so much again, Rachel. This has been so informative, so great. You've been a very, very significant addition to our project, and I'm sure all of my classmates will have a lot to learn from you. I'd like to thank you for your time, and I'd like to thank MDA for connecting us to you. It's been really meaningful. Thank you so much, and I hope you have a great day.
Absolutely. Thanks for reaching out.
Yes, thank you.
Bye.
Bye-bye.